Hi, I'm here with George Hebert, who's a counselor at our Shield Bearer Counseling Centers. And today, welcome George, we're going to talk about the topic of mental health and depression and anxiety. Depression is talked about so much as being a really big health issue in our country and worldwide. Maybe you can talk a little bit about statistically maybe like what you see and how big a problem is it? And
yes, depression is an issue. It's estimated that 300 million people suffer from some form of depression.
Mm-hmm.
Anxiety can be tied in there as well. Mm-hmm. It depends. Everybody, unfortunately, the way that we say it is that everybody's a little bit different.
Right.
Depression in men versus women looks very differently, and it would take an assessment most times to really get at the root of what's causing the problem. Mm-hmm. For some, depression looks like not wanting to get out of bed, a thought and motor, a thought and function, mm-hmm. a decrease in thought and function, or it could look like an anger, mm-hmm. or a persistent tiredness. Right. And irritation, Right. So it just depends on who we're talking about. But yes, depression is very, very real, and it is very, very treatable.
Mm-hmm. What are some of the best treatments for depression? I mean, some people take medications, but that's deeper. Is there something better, or
yes.
the first step?
Yes.
To treating it.
There are several different steps, several different ways at wrestling with the problem of depression. For some, it's a persistent issue. For some, it can just be temporary. Mm-hmm. But there are self-care methods, watching your diet and your nutrition, your exercise. Mm-hmm. Could be a method, is one personal method you could take. Talk therapy is another. Okay. Engaging in talk therapy is in my professional opinion, very, very healthy deal to seek help and to seek assistance with your problems. Come in, talk, and evaluate how you're living your life, and if you want to keep doing it that way. But yes, medications are another opportunity to take care of depression. It's just that in the mental health world, that requires a physician right. In order to diagnose and treat that. So.
How does a person know if they're stuck in depression? I mean, life is difficult, mm-hmm. and people go on, and mm-hmm. it's often hard for people to maybe even approach this topic for themselves and to get help. When is it necessary? Or
so that's an interesting question, and I would say that the best way to get at that is to attune to self. Right. You noticing that something is off, or if a loved one comes to you and says, "You don't seem yourself today. Are you okay?" And you hear that on a fairly decent regular basis. That could be grounds to, seeking help. Seeking help, there's nothing wrong with seeking help. Coming in, talking about what's going on with you, because unfortunately we can have life events that happen to us. Mm-hmm. The loss of a loved one, loss of a job, and it can put us in a bad place. And even though we get a new job, we can still be psychologically in that bad place. Mm-hmm. So.
Yeah, there's been a lot of talk about depression and anxiety resulting from this pandemic. Mm-hmm. What are you seeing in your clients?
What I'm seeing is that the stagnation, mm-hmm. I would want to say, yeah. of sitting in one place and having been in one place. Like it's difficult for clients to get that funk off of them, excuse mm-hmm. the phrase, right. To cleanse themselves in such a way. But that is, again, where talk therapy comes into play, where you can air out, realize, recognize, and alleviate some of those issues, and again, figure out what it is you want to do different.
It seems to me that there's a great stigma attached to admitting that depression is a problem for yourself. And why do you think that's the case? And do you think it's changing? Do you think there's some shift maybe between previous generations and our generation now?
Yes.
Okay.
I do believe that there is a shift. It is slow but steady.
Right.
The shift is that there are more personal books coming out that talk about depression, bipolar, various different mental health disorders. There are ubiquitous commercials about medications. There are ubiquitous commercials and infomercials about various different interventions. Of course, in the world of new age media, podcasting, there are tons of podcasts out that address mental health, both hosted by professionals, and there are also those that are amateurs or who are sufferers, and they share their experience. And that, for me, is a sign that the ground is shifting, that awareness is lifting and increasing, and as a result, we're going to have a shift, hopefully, in policy and insurances, so that there's less of a bind when people do raise their hand and say, "I want help."
What's the best thing someone can do when they recognize they're struggling?
Reach out.
Yeah.
Reaching out to a trusted friend, a trusted source, and reaching out to a local professional. Finding a fit, a working therapeutic fit with a therapist can be one of the best decisions that you make for yourself, especially because there is a level of professionalism and privacy that goes along with that relationship that is unparalleled.
How long does it take for someone to really feel the benefit of talk therapy? I guess it depends on the person, but
yeah, it does. It does depend on the person, but the feelings of relief,
yes,
not the cure, but the feelings of relief can be relatively quick. The simple act of talking out your issues and understanding where you are. It's like being in the woods and having a map. Sometimes when you get lost, you have to take a moment and really focus on what the contours of the map are telling you and the lay of the land and where you are. And once you find your footing and once you find your location, you can find your way out. And so the relief of knowing where you are on the map is kind of the first steps of the first few sessions of counseling.
That's great. Thank you so much for sharing. And do you have any last thoughts or anything you would encourage people to do?
I would encourage people to just seek counseling, seek help early and often.
Great.
That's what we're here for.
Great. Thank you so much, George.
Thank you.